Hi guys, welcome to the second episode of my English Way. I'm Gardenia and I'm here to talk about trauma and how to overcome it. Today we are talking about the second chapter of The Body Keeps the Score, Brain, Mind and Body in the Healing of Trauma. The author of this book is Bessel van der Kolk, and in this chapter, he talks about the revolution of drugs in treating mental problems. And we can maybe pay attention to the chapter thinking about a question that is: should mental illness be treated with therapy or with medication? Then let's start. Imagine working on a psychiatric hospital in Boston in the late 1960s. Many of the patients there are young people experiencing their first mental breakdown. Some cannot move for hours, some hear voices, others suddenly become violent or withdrawn. In the late 1960s, the doctor was in charge of recreational activities for the patients of a research division at the Massachusetts Mental Health Center, the MMHC. They were trying to discover if psychotherapy or medication was the best decision to treat patients who had the first mental problem. And at that time, those problems would be diagnosed as schizophrenia. At the MMHC, part of the talking process was their first decision when treating those people. And the doctor's job was to keep students at the MMHC participating in normal activities, and he learned how to deal with outbursts and withdrawal in there. And he witnessed one patient having catatonia, being immobile for 12 hours at least. And he said that at that time they couldn't do much and they only let it run its course. It was what he said. And when patients couldn't sleep, they would go to the nursing station and they would share a lot of bad things that happened to them with nurses in there. And for Van der Kolk, they know that half of people who search for psychiatric treatment were assaulted, abandoned, neglected, raped as children, and they also witnessed violence within their family. The time he had his second job at a Catholic hospital, he was doing some examinations to some women that were about to receive electroshock treatment for depression, and he asked about their lives and he managed to talk with them, and many of them spilled out horrible stories about their lives. And one of those stories was about having difficult children, and that hit home for me because I know that a lot of women are mothers and they have difficulties raising their children. And in fact, I think that, or most of people, they think that when you have children, you are obligated to do everything to your children. And this idea of needing a village to take care of a child disappears. Those women, they spoke to him and thanked him happily because he listened to them. He would feel really bad about those meetings, in fact, because he said that the treatment they would receive the day after would erase their memories of their conversations. And he confessed that he didn't really last in this job. And he quotes a book. This book is written by Eugene Bloilers, and it's called Dementia Blackhawks. It's from 1911. He said that in this book, Bloiler had some fascinating observations, and one of them was that among schizophrenia body hallucinations, the sexual ones are by far the most frequent one and the most important. And this observation in this book made the doctor wonder if the patients were having such hallucinations and they told the doctor a lot of horrible stories when they could not sleep. Then, were those hallucinations in fact pieces of their own memories, pieces of their own experiences? And he said that our research has shown that people who suffered abuse as children, they feel some sensations such as abdominal pain that had no obvious physical cause. And they also hear voices accusing them of evil crimes. And on the ward, people engaged in violent and self destructive behavior, especially when they were frustrated or misunderstood. And after that, he talked about a patient he had, and he called her Sylvia. And he said that Sylvia was a gorgeous 19 years old student at Boston University who had a mysterious aura because of her reputation of being a girlfriend of a Boston mafioso. Then he said that the doctor at the ward decided to force feed her because she was not eating and losing a lot of weight. Then three people held her down to get her to eat through a feeding tube in her throat. Sometime later, he said that Sylvia told him she was sexually abused by her uncle and brother during her childhood. And after that, the author thought about the carrying act and figured out that it could have had the same effect like a gang rape to her. And because of that and other experience that he had, when teaching his students, he formulated a rule to them. And he said to them that if they someday they happen to do something to a patient that they wouldn't do for anyone in their family or children or friends, then he said that don't do it. This is because they could be replicating some kind of trauma to their patient. Then, and another thing that he told in the book was that he noticed as a recreation leader for the patients, he noticed that they were extremely clumsy and physically uncoordinated when playing volleyball. And he said that the staff from the ward were much more coordinated than the patients. Also, in conversations, he said that they didn't have facial expressions and natural flow of gestures that people could commonly have among friends. But he said that he wouldn't explain that much right now, but he would come back to that later in future chapters. 1968, the doctor said that the American Journal of Psychiatry published the results of the research Van der Kolk attended at the ward, and it affirmed that patients who were administered drugs alone had better results than the ones who had several talks with the best therapist in Boston. This result was one of the milestones that changed how medicine and psychiatry approached psychological issues. And now problems people would struggle to manage, such as anger, pride, were all treated as disorders. And those disorders could be solved with administrations of some drugs. Doctors were all embracing pharmacological treatments, and he was the first psychiatrist in Boston to administer lithium to a patient. On lithium, a patient who was suicidally depressed from time to time, he said, stopped that cycle and started to be stable. People who were locked on their terrified realities were then returning to their families and friends. Antipsychotic drugs were a big factor at that time that made the number of people in hospitals diminish. And his first job after his residency in 1974 was one of the directors at the Boston State Hospital. He said that everybody in there knew the patients and their particularities, but uh, 5 years later, in 1979, after the doctor went to work at the VA clinic, the Boston Veterans Administration Clinic, the Boston State Hospital was locked and it became a ghost space. And then he started to talk about a really interesting experiment. And he said that 1984, after some lectures about drug development at the American College of Neuropsychopharmacology, the doctor heard a presentation by Steve Meyer, and he said that they administered a lot of electroshocks to dogs who were in locked cages. And he confessed that he being a dog lover, he couldn't do that. And after he described that, I can understand why. And then he said that Stephen Meyer called that experiment inescapable shock. They kept administering shocks to dogs in closed cages, and after that, they opened the cages and administered more shocks to them. They had a group of dogs who had never been shocked before, and when they opened the cages, they would run away. But the dogs who had been subjected to earlier inescapable shocks, they couldn't do anything and they stayed stopped in there. They couldn't run. Those dogs didn't attempt to run. And even if the door was wide open, they would stay there suffering. The conclusion was that even if they had the opportunity to escape, they wouldn't do it because of the traumatized situation. And they extended that interpretation to people as well and said that, like those dogs, traumatized people wouldn't enjoy the road to freedom. And like those dogs, many traumatized people only give up and stay stuck in their fear. What they did to those poor dogs is the same to what happens to traumatized people. They too had somebody to do terrible harm to them, and they don't know how to escape from this harm. The doctor made a review of his patients, and he said that what happened to almost all of them when they suffered trauma was that they were trapped or immobilized, unable to take actions to stop what was happening to them. They couldn't stop the inevitable. And in here, we can make a connection to what the doctor talked about the patients at the ward playing volleyball and being uncoordinated. Maybe after trauma, because they were immobilized when they were suffering trauma, maybe after that, they stayed that way. And because of that, they don't have so much control of their body and they are clumsy and uncoordinated because of that, because of what they suffered. He continues saying that Maya found that traumatized dogs release more stress hormones than was normal. Also, traumatized people keep secreting a big amount of stress hormones even longer after the danger passes. And he quotes the researcher called Rachel Yehuda, and he said that she found that cortisol finishes with the stress response. Cortisol sends an all safe signal in post traumatic stress disorder, PTSD, but the stress hormones do not return to its basic level after the threat has passed. Our stress hormones should give a lightning fast response when in threat, but return to equilibrium after it, after the threat passes. In PTSD, the fight, flight, freeze signals are on even after the danger and don't return to normal as in the case of dogs. Meyer and Seligman found that the only way to get the dogs out of their cage was to repeatedly drag them out. Then, only doing that, they could physically experience going out of the cage. The doctor was then thinking if his patients had to have the same physical experience to get out of the situation and experience a sense of control. Then the doctor asks, and I open quote for him, what if they could be taught to physically move to escape a potentially threatening situation that was similar to the trauma in which they had been trapped or immobilized? End of quote. And he said that in part 5 of this book, this is the conclusion that he arrives. Other researchers with other animals such as mice, rats, cats, monkeys, and elephants brought even more data to scientists. With mice, they discovered that a group of them that had a warm nest and were fed well, and another group that had a noisy home with almost no food would every time return to home. Even if they were scared animals, they would return to home even though they weren't feeling safe. Then after that, the doctor thought about his patients, and those patients would return to home just to be hurt again. They were traumatized people that searched for safety in a familiar environment. And then he was asking himself, and I open quote, are traumatized people condemned to seek refuge in what is familiar? End of quote. For the doctor, many traumatized people search for experiences that would repel the most of us. And in his experience, they complain about a kind of emptiness when they don't feel angry or involved in some dangerous activity. He told us in the book that he had a patient called Julia, and Julia was raped at gunpoint at age 16. She got involved with a pimp who prostituted her and beat her. She went to jail, but she always would return to the pimp. Her grandparents paid for her rehab program, and she started to take courses at a college. But in there, she had a relationship with a classmate that didn't go well. After that, she was with an addict on a subway, and this guy beat her and stalked her. She started to become motivated again to return to her treatment when she was severely beaten again, one more time. And he said that for Freud, this would be called the compulsion to repeat. And he said that this is a reenactment that is to be motivated by a past event. And he said that Freud believed that people would do that unconsciously. It is an unconscious attempt to get control over a situation. But the doctor didn't agree with that. For him, this is a false theory. And he said that repetition only brings more pain and makes the person hate themselves even more. Even reliving past traumas in therapy could lead the person to be more preoccupied, he said. In 1970, he said that Richard Solomon showed that the body is capable of adjusting to different stimuli, and activities like using drugs can make people feel good, but also activities such as sauna bathing, marathon running, or parachute jumping. Those last ones, he said, can cause discomfort at the beginning, but they will become enjoyable activities after some time. And he said that when people push their bodies to the limit, this can cause a sense of well-being and satisfaction. We can crave all those activities and feel withdrawal if we are not doing them after some time. For the author, innovation in some perverse way can be transformed into pleasure, and it can explain why people return to others that hurt them. And in the book by Oprah Winfrey and Dr. Bruce Perry called What Happened to You? Conversations in Trauma, Resilience, and Healing, they also talked about that, and they said that women that return to the same violent situation, or maybe their violent husbands, they are doing that because they are accustomed to that. Their brain is accustomed to that situation, and then they return to what is common to them. And to them, to going out of this situation, they have to have a lot of energy to train their brain to do differently. After that, the doctor states that based on some severe wounded soldiers that didn't want morphine, and Beecher thought that strong emotions can block pain. Based on this speculation, Van der Kolk and some others asked some Vietnam combat veterans to do a pain test at the same time they watched some movie scenes. They measured how much time they could keep their hands in ice water when seeing a combat movie. They calculated that the amount of analgesia produced in this test was the same as the one produced with 8 milligrams of morphine. This is the same dose administered to people with crushing chest pain. Beecher's speculation is in fact the release of morphine-like substance produced in the brain, is that the repeated exposure to stress can lead the person to feel less anxiety. Of course, it can't really explain why Julie kept returning to the violent pimp. And after that, the doctor starts to talk about Prozac. And he said that Prozac became a highly successful psychoactive drug, and Prozac was released by Eli Lilly in 1988. The doctor prescribed Prozac to a woman that, after some days taking it, confessed to him that she started to eat when she was hungry and spent her time doing her school work. Then she started to do daily basis things. He said also that a chronically depressed patient would ask him to skip an appointment with him because she wanted to spend a day with her kids after 4 days on Prozac. And he said that after Prozac, people started to live in the present. He later made a study with 64 people and they all improved in some level, even the ones who took the placebo. People who received the real Prozac slept better, had more control of their emotions, and were not so preoccupied with their past compared to the people who received the placebo. But the Prozac had no effect with the combat veterans at the VA, and their PTSD symptoms did not change. Prozac and other drugs made a huge contribution in treating PTSD patients. They revolutionized psychiatry, providing a tool different than therapy. Then, when the doctor was a ward attendant, he would spend hours with patients in the gym where they could feel a sense of well-being. After the drug revolution, those spaces became places to be fixed. This revolution had so much promise, but it made as much harm as good, he says. The idea that mental problems were the result of some substance imbalances in the brain that could be adjusted by some drugs was accepted. But this made people suppress their problems without taking care of the underlying causes. The prescribed antidepressants can be very helpful to help people with regulating their emotions, but it should be considered only as a part of the treatment. The doctor conducted a lot of studies about medication for people with PTSD, and he concluded that those drugs present a serious downside because they diminish the importance of dealing with the underlying issues of their feelings. He believes that if those medications were in fact so effective, then depression would be a minor problem in societies. The reality is that the use of those antidepressants only increased and the number of depressed people in hospitals didn't change. He informs that Medicaid, government health program for the poor, spends more on those drugs than in other class of drugs. One curiosity is that children from low income families are 4 times as likely as private insured children to receive antipsychotic medicines. Sadly, he says, those drugs are prescribed to the neglected and abused children are more manageable, and the problem is that those medicines also interfere with motivation and curiosity, for example. and those children present more risk of becoming obese and diabetic. Sadly, the fact that we can find balance and change our own psychology throughout other means is rarely considered by mainstream medicine. They prefer the brain disease model. And for him, this model ignores four facts. And now I open quote for him. The first fact is restoring relationships and community is central to restoring well-being. The second one is language gives us the power to change ourselves and others by communicating our experiences, helping us to define what we know, and finding a common sense of meaning. And the third one is we have the ability to regulate our own physiology, including some of the so-called involuntary functions of the body and brain through such basic activities as breathing, moving, and touching. And the fourth one and final one is we can change social conditions to create environments in which children and adults can feel safe and where they can thrive. And then we have the end of the quote. If we ignore the humane dimensions in trauma, we can neglect forms of people to gain their autonomy and heal from their trauma. People have to feel as being a participant of their own healing process, being part of a community in order to regain their inner sense of self. Knowing that drugs are limited, he started to ask himself if there were more natural ways to deal with post-traumatic responses. And that was our second chapter, and I leave you with a question. What do you think happens when we treat symptoms but ignore people's stories? You can answer in the comments if you like, and if you like this episode, share it with someone that may benefit from listening to me. Thank you so much for listening. See you next time and have a great one.